My name is Bernard Gold. This is discretionary benefits for activity one. With a tight job market, companies are becoming more and more flexible and accommodating to the needs of employees by offering a range of attractive discretionary benefits. What may have previously been considered an additional expense is now seen as a smart investment. And as a result, many companies are offering discretionary benefits as a strategic maneuver to try and attract and retain certain talents, as well as establish themselves as an employer of higher choice. The discretionary benefit that I decided to choose was health insurance. Health insurance pretty much covers essential health benefits critical to maintaining one's health, treating illness, and certain accidents. It protects you from unexpected high medical costs. It helps pay less for covered in-network health care, even before you meet your deductible. You're also entitled to free preventative care such as vaccines, screenings, and some checkups. And the coverage, for the most part, incorporates not only the one that's currently employed, but their family members, along with those who have already been with the company and have retired, they are also entitled to certain benefits. What that addresses: lower healthcare costs. Being insured promotes healthy behaviors, mitigates health risks, and helps detect signs of chronic diseases early. This sequence results in lower healthcare costs. Next prompt: increased productivity. Focusing on an employee's health means an increase in productivity. Having access to health insurance and programs alike mitigate conditions associated with poor productivity. Lastly, we have reduced absenteeism. Absenteeism. Better healthcare means employees will take fewer sick leaves. This will then influence a boost in productivity levels overall. Healthcare benefits for recruitment and retention. Companies that offer good competitive healthcare benefit packages see boosts in employee recruitment and retention. With the cost of healthcare increasing each year, employer-sponsored healthcare enables employees to share the cost of health insurance with their employer. While salary is a top motivator for job seekers, good healthcare benefits are also a crucial part of compensation, and employees are willing to accept a lower salary if their employer helps with medical costs. With so many other companies offering medical insurance to their companies, you risk losing your best talents to those companies. Those that are receiving healthcare insurance from their companies view it as a key factor in staying with that current employer. As I stated earlier, recruits usually focus on benefits first and then salary second when it comes to looking for job positions. And for most employees that are already employed, health insurance was either the deciding factor or a positive influence in staying currently employed with that current job. Ultimately, healthcare benefits and retention go hand in hand. Costs. The cost for smaller businesses, especially many discretionary benefits, may be too expensive, and premiums can increase from year to year. There are also administration costs associated, which can add up quickly if you are offered a larger package. When companies are choosing plans, it's best that they select a variety of plans from which your employees can choose based on their needs and budgets. By giving employees options, they can match their coverage type to their budget. In some cases, most employees are willing to contribute to their plan just to have the coverage. You can lower overall costs when employees pitch in to help those costs. The value in this case stems from the idea that health insurance doesn't just benefit your employees. Ultimately, they benefit the company and may actually help in increasing profits over time. Healthier and happier employees are much more productive, and in a healthier workplace, it can cut down on insurance costs overall. Compliance/legal issues. Healthcare compliance means meeting all of the rules and requirements applicable to an organization across a broad range of criteria that may vary depending on the type of organization along with the services it provides. In this case, I chose to talk about the HIPAA laws. The HIPAA law is a federal law that requires the creation of a national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. However, it should be mentioned that there are certain restrictions. That if you receive a health plan from your company, they are not required to follow certain laws regarding that. However, as an individual, you can restrict how that information is used. For example, you can opt to receive a notice that tells you how your information may be used and shared. You can request that a covered entity restrict how it uses or discloses your health information. And you can also get a report on when and why your information was shared for certain purposes. Effective communication tools. Employers, particularly those that offer healthcare benefits, know the importance of communicating the value and details of benefit options to their employees. However, they have to find the most suitable way of conveying that information to them. This is where we get to the first tool on the list, exchange notices. These notices provide employees with information about how to access and use state health insurance exchanges. Topics in the exchange notices include the existence of the employee's health coverage or lack of it, the services provided by the employer, and the exchange on information on how employees can contact the exchange to request certain assistance. Second on the list is an SBC, a summary of benefits and coverage. This is a standard communication tool used by employers, health plans, providers, and insurance companies. They're intended to help employees and their family members make informed health coverage decisions by giving them the chance to compare plans offered by the employer and those available on the exchange. The last tool on the list, a summary plan description or an SPD. This is a benefits plan that has long been required of employers to inform participants in an employer-sponsored benefit plan about the plan's provisions, its operating procedures. It also provides information on topics such as when an employee can begin to participate in the plan, when the start date, how services and benefits are calculated, when benefits become vested, and when and in what form benefits are paid, and how to file a claim or benefits. There are numerous health programs that contribute to an organization's success. Nevertheless, HR professionals should learn to revise the level of coverage in their health plans. It not only helps the company look more appealing to potential employees, but can also aid in increasing morale, raising retention rates, and overall increasing profits in the long run for the company.